Yes, thank you, Sam. And hi, everyone. Thanks for spending this time with us today. I'm Lauren O'Hanlon. I'm a senior manager in healthcare practice at Deloitte. Like Sam mentioned, I've been with Deloitte for 11 years now, leading tech-enabled rev cycle transformation work. So everything from back in the day, HR and CRM selection and optimization, to now advanced analytics and automation and insight-led workflow change. I'm here with Deb Wierciak, who, as you know, is the VP of Business Support at BJC, and that includes all things analytics. I've had the privilege of working together with Deb at BJC now, excuse me, for a few years. We're excited to have her share her experiences with you all today. Deb, do you want to do a quick introduction, and then I'll get us started in the conversation?
Sure, I can. Deb Wierciak, I've been with BJC about 23 years. BJC's healthcare system in St. Louis and metropolitan area, 11 hospitals, $5.3 billion in revenue. In terms of my areas include analytics, as Lauren mentioned, as well as I do have the training and quality area, a small PMO, which works very closely with the analytics, technology team internal to revenue cycle, the revenue integrity group, as well as kind of a unique group called our hospital liaisons, which is a group of project managers who provide communication between our revenue cycle and our operational hospital leaders, whether it be for revenue integrity, charge errors, multiple things, as well as just sharing our operations and our KPIs and analytics results with those hospitals. The liaisons do handle that.
Great. Thanks, Deb. And I want folks to kind of remember those different top focus areas that Deb has, because I think it's so important as we'll start to talk about getting started, piecing the training, as well as the different hospitals, as well as the core central analytics team. So we'll talk about that in a minute. But, you know, Deb and I are going to talk about how you get started with taking action using all the advanced analytics we've been talking about thus far. You know, I started my career in healthcare as a service line analyst at the Hospital for Special Surgery back in the early 2000s, you know, really trying to figure out how much variation we had for a total knee, et cetera. And I was using a mix of green screens and crystal reports in Excel. And, you know, I now lead rev cycle transformation work at Deloitte. And while my enthusiasm for data-driven action has absolutely remained the same, you know, the data that we have available to us and the way that we can employ it has drastically changed, as Aaron and Curtis and Chris, Matt, Sam have all articulated. You know, rev cycle in particular obviously has ramped up exponentially, given the tools and teams we have at our fingertips. And, you know, there really are two components to it. First, you know, is the insights we've really been able to, we're able to extract has changed. You know, we can now translate more insights into action-oriented steps, either informing automation or taking action using those advanced analytics. You know, now once we have the data, we need to do something with it and set up the right infrastructure to be able to use it in a way that creates action, make it sustainable, more importantly. You know, Deb, you and your team have had a ton of success this year leveraging data and analytics to improve rev cycle performance. Can you share a bit more on what has allowed you to progress and really be successful in your analytics capabilities?
Yes, and I'm going to begin with a little background on our revenue cycle. So it wasn't until late September of last year that all of our hospitals are now on Epic. So we are functioning in a world where we deal with multiple systems through with a lot of providers these days. So multiple of our facilities had been on Cerner Sorian. We've been transitioning to Epic over the last couple of years and also have a hospital on Meditech. So addressing our analytics on these multiple platforms was and continues to be a priority so that you have appropriate comparability. Initially, we used Tableau quite a bit, and then candidly, that gets you only so far deep into the data. And in our partnership with Deloitte, we've used a lot more in terms of the revenue intellect to be able to get into the more transactional detail, whether it be a lot of the EDI transactions, the RARCs and the CARCs, et cetera, the 835 data, as some of our other presenters had mentioned, but also into our staffing transactions in terms of what the staff is actually doing and looking at their comments and their activities and doing that analysis in terms of the touches on accounts to look at opportunities as well. For a number of years, we have used key performance indicators and have an executive scorecard, and that's kind of our overriding guidance. But about 3 years ago, we actually went in a step further and kind of did what we call functional KPIs. And that's actually having metrics for each functional other area, whether that be patient access, HIM, revenue management, and revenue integrity. We use those documents internally as well as with our hospital stakeholders to look at opportunities and to help identify those projects, whether they be in denials, whether they be in productivity, any of those various areas. Using those KPIs, some of the examples that I mentioned, we actually expanded in terms of avoidable adjustment dashboards, and another one in terms of vendor performance reporting. And in terms of vendor performance, that's a good example to talk about a little bit, because every vendor will provide you with reporting, and their reporting is going to be based upon their systems and how they're accustomed to reporting. But if you're using more than one vendor to provide the same service, if you could utilize your own analytics, you could ensure that you're really getting comparability into that data, and ensuring that the vendors are meeting their service level agreements, as well as just even basics in terms of processing invoices, et cetera, and then looking at their performance and their comparison. Lauren had also mentioned in terms of kind of our team structure and that the areas I have, and I think it's beneficial in terms of how those teams work together, because you can have an analytics team issue a lot of reports, but I think the importance of our team structure is kind of the use of those analytics and that data. So I mentioned that we have this group of liaisons. So the liaisons, for example, have led our denial prevention task force and sub-teams in that area. They work with all the leaders within revenue cycle, revenue management, patient access, et cetera, as well as with the hospital leaders. So they have that direct relationship with the hospitals. As all of the revenue cycle areas have consolidated, over the years, I think some of the hospitals felt a little more removed. And a question that came up on one of the other presenters of, well, how do you still impact those operations? And I think those liaisons have helped do that because they still have the relationship with the people in the hospitals that in some case may be involved in auths. There may be trends with a particular physician that we can address, whether it be on documentation and HIM or other various aspects. So we use those liaisons to help identify projects and to help resolve. And I mentioned having the PMO team to kind of manage some of those projects. And then as those opportunities are identified, then I also have the training and quality team that it may be a training issue in a particular area within revenue cycle that we can address to get more consistency and improved operations. So that's kind of how all those areas are kind of working together, as well as with revenue integrity being various charge errors and items that come up on the revenue side.
Yeah, no, thanks, Deb, for that kind of overview on how you set up the infrastructure and how the team's working together. I think it's been, integral, not just from, leveraging our data, Rev Intellect data or other data to create actionable insights, but also in managing across the training team, as well as the liaisons that you mentioned across the hospitals, as well as the core rev cycle team. I know, that really worked well from our perspective in terms of helping to support performance improvement. So maybe, do you want to talk a little bit about the specific areas in which you've been able to make impact, whether it's, the denials prevention team structure or kind of payer scorecards and analytics? I'd love to hear a little bit more about, those types of things as well.
Yeah, so in terms of, I'll begin with denials. That's probably what we did kind of early on in terms of our projects with you as well. And in terms of using Revenue Intellect so that we could look across those various patient accounting systems to identify where there were opportunities for denials. Sometimes it's a matter of going down a particular road and finding out that there really isn't an opportunity because we'd like to say our payers consistently use their codes, but they do not. So determining kind of that normalized data and where there is opportunities and how they can be addressed. And in doing that, there was multiple kind of sub-projects that resulted. Overall, just over a year, is probably about $13.8 million in denials recovered, whether that be on missing attachments, things in discharge status, teams in documentation, selection of insurance, et cetera. And using a lot of that Revenue Intellect data, we were able to identify the issues. And not just that, I think something that I think in kind of make an overall healthcare that we've not been as good about over the years is continuing to measure things going forward and continuing to keep those gains. You could fix it today, but can you maintain it and continue to keep those gains? So using that tool has helped us to continue to measure those areas to ensure that we're maintaining those gains that we identified. Another area we used, I had mentioned in terms of our last 6 hospitals went live on Epic to the end of September, is we've kind of used that to measure the various waves of go live. We've kind of done it in 3 waves: our initial hospitals, then the academic facilities, then our community hospitals. We were able to kind of do some various metrics along the way, kind of comparing the waves and comparing each hospitals to ensure that we were meeting our operational needs as well. And candidly, they were very successful in terms of doing that.
Deb, I got a question for you. So I know that we've used Revenue Intellect to set up infrastructure. I know we've used it to empower the liaisons and connect the liaisons to the training that's under your guidance as well. So that's a lot of how we've gotten to kind of the operational changes. But I think one of the things that keeps coming up, no matter who I talk to in the industry right now, is around payer issues and delays in payment and reimbursement. Can you speak to a little bit about like how you guys did the investigation, how you figured out there were some bad behavior from payers that had to ultimately get solved for?
Yeah, it was interesting because when we're seeing some lower cash, you immediately look to denials, and we were addressing that. And candidly, our denial rate wasn't going up. But what we did, one of the kind of the unique analysis, was looking at the number of touches to get to an account resolution, and then some of it being, okay, is there items that we can assist training our staff to reduce the number of touches to get to resolution, or were there cases that it was the payer delays? And then based upon those payer delays in those analysis, we've done a significant amount of work with our managed care contracting, JOC operating committee meetings with the managed care plans to specifically identify the issues. And it's been helpful not to have just an account by account, but be able to use these analytics to say, here is a bolus of accounts, and here's what the issue is, to provide to the payer to have them address it more expeditiously.
And Lauren, I know from a Revenue Intellect standpoint, you guys were helping Deb kind of use RI to generate some of those list of accounts and do some of that investigative journalism, if you will, prior to those JOC meetings.
Yeah, and I have to say, Deb and the BJC team have done a phenomenal job, over this past year, really setting up the infrastructure to pull those insights, that we've been pulling from RI to actually share with the payer instead of, again, sharing one account or 2 accounts, really cohesively looking at each payer, one by one.
The other thing that I think is maybe a little unique in our structure within revenue cycle, we have what we call kind of our high reliability system, where it's actually a group of huddles that are very short, 15 to 30 minutes. Some areas meet daily, some meet 2 to 4 times a week. And they actually begin with staff and supervisors and leaders, leaders and directors and VPs, and literally VPs with the chief revenue officer. We meet 4 times a week. And if there are issues or anomalies that we're noting, it can literally be escalated very quickly. There's also a number of metrics that are embedded in those daily meetings that are monitored on a daily basis, not just waiting till month end. So I think it's getting those metrics back in front of the closer to the operations and the various leaders so that we have the opportunity to address the opportunities very early in the process. So I think that's another way we've kind of used our metrics to get closer to operations.
That's great. Deb, so if you had to kind of boil it down to, 3 things that have allowed you to be successful with your analytics capabilities or 3 components, do you have a way to kind of frame it that way?
Yeah, and I think we do have the advantage of our structure. I mentioned that in terms of the areas working together. So it's not just an analytic area kind of going out and saying, oh, here's some area to look at. We have people and teams that can take it forward and take that issue forward and bring it up through the organization. Another piece of this that it's kind of maybe a lesson learned as well is to try to get as much standardization as you can as earlier in your process, whether it be even naming conventions on payers, trying to make comparability, in terms of those actual plan names that you're using in various systems, so that when you're accumulating that data, either to compare for your internal resources or to share with the payers or with your contracting arm is in terms of ensuring that you have comparability in terms of that data and standardization as much as you can. So that's a big piece there. And then the other one is just sharing that data and communicating it with the operational leaders, and also having them understand those metrics. Not just here's a number, but have them understand how those metrics work and how it's impacting their operations.
That's awesome. Okay, and then I got one last question for you, Deb. But you know, are there areas that you've been able to kind of really hone your impact through leveraging advanced analytics? You know, Curtis and Aaron talked a lot about advanced analytics and why it's valuable and what the techniques are. But I got to imagine, if you had to paint a picture for, you know, the operators on this call, you know, what are the specific areas you've been able to really drive results based on analytics? Do you have a perspective on that?
Yeah, I'm going to give you two. And the first one, I'm not going to go into too deeply because it's kind of, I'm going to say, pretty common. And that's looking at denials prevention and looking at denials in that piece. Sure. What I think is probably maybe a little more unique from the perspective is that when we use those analytics in terms of driving our revenue management results in terms of cash collections, whether it be on productivity. So using those analytics to develop more specific work lists and unique work lists to saying, okay, here's a specific item. And instead of this group of people maybe dealing with 20 different types of denials or 20 types of different accounts, to try to narrow their scope so they can really become experts and really see the trends and the issues more quickly. So using those analytics to try to drive your the development of your overall operations. What do your work lists look like? What's the frequency of touches? You know, don't use a standard, don't have everybody follow up in 30 days. Maybe, you know, with this payer, you can actually start following up on 15 days and look at your results to say, maybe there's another payer that, you know, don't bother until 35 days, so that you're effectively using your staff. And I think using those analytics to be more effective in your staffing and in your, particularly in the revenue management area, I think has been very effective for us in the last year, and really resulted in improved cash collections from that side. So I think that maybe is a different aspect of using it, not just the write-offs per se, but kind of the throughput of your organization. I think it was Curtis who mentioned process intelligence. And maybe I don't call what we have done as much maybe as specifically as process intelligence, but learning more about that process so that we can be more intelligent in how we staff and their particular activities they perform.
I love that, Deb. And Deb, Lauren, we are out of time here, but I wanted to thank you, and I wanted to thank all the clients and colleagues on this call for spending the hour with us, talking through some of the challenges and successes you guys have had over the past year. I wanted to thank the Beckers folks, and I'll turn it over to them to close us out.